Welcome to Public Health Matters, where we talk about matters of public health. I'm Bobbie Bagley, Division Director for the City of Nashua's Division of Public Health and Community Services. And I have with me this afternoon Bob Mack, who is our Welfare Officer, and Bob is going to speak with us today about all things related to welfare administration and our welfare services. So Bob, tell us a little bit about yourself and about the Department of Welfare.
Okay. Well, thank you, Bobbie, for having me. As you mentioned, I'm Bob Mack. I'm the Welfare Officer for the City of Nashua. I manage the Welfare Department. I've been with the city almost 23 years in this role. Our Welfare Department is part of the Division of Public Health and Community Services, which of course is made up of community health, community services, environmental health, and then welfare. And over the years, we all have worked in various levels together. Our focus in the department, we focus on social determinants of health, trying to assist people who have financial hardships within the city limits, and either assist them through general assistance or referrals to other resources in the community. So in accordance with RSA 165, the statute that oversees general assistance in the state of New Hampshire, every municipality must provide some form of general assistance. So if people are in Nashua, they can contact our office. If they're in another municipality across the state, they would contact their town office to request certain assistance. Generally speaking, each municipal welfare office provides basic assistance. It's designed to provide like interim assistance. We're not really long-term assistance programs, but we focus on helping people with basic needs, such as rent and shelter, roof over their head, food, making sure their utilities are on, heat in the winter, electricity, that sort of thing. We help with some prescription assistance if there's some gap in coverage of insurance coverage. And occasionally we help with burial or cremation assistance.
Yeah. So over the past couple of years, especially, Bob, post-COVID, we saw some changes in the needs in the community.
Absolutely.
With regards to assistance, in particular for housing and rental assistance.
Yes.
So there's been some transition with that. And then we also, in the past few years, have had an increase in need in so much that our welfare assistance went above what we had in our budget.
Yes.
So can you talk a little bit about that, and what are some of the changes that you expect to see coming down, especially within this year, because now we're 4 years post-COVID, right?
Yep. So those are very good questions. We did experience quite an increase more recently after a lot of the COVID money that was injected into the state. A lot of money came from the federal government to the states, and they developed different programs to assist people with rent. There were people actually that were experiencing homelessness that had been put up in motels for sometimes 18 months, close to 2 years.
Right.
And so when that funding was exhausted, a lot of those folks came to the municipal welfare offices to try to continue that assistance.
Right.
So prior to that, I mean, we've always helped in some way, shape, or form to assist families and households that are experiencing homelessness. We usually do that by trying to connect them to a shelter program. So we work very closely with, here in Nashua, our Nashua Soup Kitchen and Shelter, and the Rescue Mission, which provides emergency shelter for single individuals. But again, when COVID came, and there were a lot of people that were experiencing more financial hardship because a lot of, places of employment were shutting down, and so people needed some money, they needed some support. They would put them in those motels. When that funding ended, as I said, they all started coming to municipal welfare offices.
And by the RSA, the welfare officers have to respond to that need.
We had to respond in some way. If we could not get them into shelter programs, a lot of times we would continue that assistance for a period of time. One of the things that we do is we do have an eligibility process, and so people must apply for our assistance, and they must show a financial need for that assistance.
What does that process look like, Bob? So what should people expect if someone were to come to the welfare office and they are in an emergency situation maybe the utilities are threatened to be turned off. And in fact, we're in October now, so people need to get their heat on, so people might find themselves in a particular situation. Or they need emergency rental assistance. What does that process look like? And where, Bob, would there be a situation where our welfare office may not be able to help them?
Certainly, sure. So the process is, we have, right now there are 5 staff in the welfare department. We have myself, who manages the department. We have an intake specialist, who basically is that initial contact, who will see the client when they come in to ask for assistance and does a basic assessment of need, urgency of need. Do they need to be seen more immediately, or can it be put off for a week or so?
Right.
So based on that evaluation, they will be given an application and some additional requirements. So as I mentioned, we have an eligibility process. We have to get verification of any income for the household versus any expenses that they may have. And we do some general calculations based on that. But upon that initial intake, we generally have a 72-hour window to get someone in if there's an urgent need. Now, we try to see people the same day, but we can't always do that. So if we can't see them, we try to connect them to other resources. But we try to see them as soon as we can. And then from that intake process, they complete an application, they provide the required verification documentation, again, bank statements, pay stubs, whatever it may be, proof of Social Security benefits or any state welfare benefits. They bring that in versus with the proof of their expenses, rental expense, utility expense, et cetera. And then that information will go to a welfare specialist, who will then do the evaluation, meet with the client, do an interview, ask some questions, verify whatever information they brought in. And based on that interview and verification of those documentations, we can calculate a basic need. So there's a financial component to it, but there's also, there could be some extenuating circumstances.
Right.
So, for example, you mentioned utility assistance. As we're getting into the winter months, there is a winter moratorium that starts November 15th, so that it's not that people cannot get disconnected from heat or electricity in the winter, but it's a little more challenging for agencies to do that, to disconnect that service for obvious reasons. We want people to be safe and have heat in the winter, and they need electricity and natural gas or what have you to be able to heat their homes. So prior to that moratorium, what happens is a lot of the companies are trying to collect their revenue and their income, the money that people owe on their bills. So we usually see a bump before that time, which we've been seeing, more people coming in asking for assistance. So generally what we do in that case is we will, again, collect the financials that we need, evaluate what is their urgency and what can we help with to then get them on some sort of reasonable payment plan or whatnot. A lot of times if they don't come to see us and there's no determination of a financial hardship, they will be required to pay a significant amount of a bill, sometimes 50 to 80%. With our assistance, we can pay about 10% of that bill and then get them into a payment plan, so that extends beyond the winter months. We also refer to other agencies in the community. We refer to Southern New Hampshire Services, which recently, I believe, changed their name to Community Action Programs of Hillsborough, Rockingham County, I think is the correct name.
I did see that about a couple of weeks ago.
Right.
That came out.
So we will refer them to apply to the Fuel Assistance Program, which can assist, do similar things to what we do. They have a different funding source. They can help with utility bills and then also help them get set up on payment arrangements. So it can really be a joint effort because we may not be able to do everything and help with everything that they need, but if we can help with a portion of it and then connect that client to another resource that can help with another portion, it will help them to get into a better situation financially so that they can keep up with those expenses.
Right. And so you mentioned the CAP agency, formerly Southern New Hampshire Services. And then, so what other agencies can support with some financial assistance? Because I do know that we also have the Financial Assistance Network, right? And we're a part of that. What other agencies are a part of that? Just so that our viewers that are watching Public Health Matters today have a better understanding of how that entire system of support works for individuals that might find themselves in those situations. And some people will come once for support, and some folks may come a number of times for support, right? And so what are the other services or organizations that support assistance?
Good question. A lot of folks start with us, and we will then refer to some of these agencies, like the Front Door Agency, for example, provides some financial assistance.
And the Front Door will provide assistance for housing or for all the things that you're talking about, utilities as well?
It's primarily housing
Okay.
and eviction prevention.
Okay.
They have provided some security deposit assistance as well. The Salvation Army has some resources as well to assist with utilities or rent. They're usually smaller amounts. They can also help sometimes with prescription assistance. There is Catholic Charities and Corpus Christi and Family Promise, and they all kind of work together as part of that financial assistance network to say, okay, so we look at what can city welfare assist with, if anything, and then we make that determination, and then we will push that out through the client to these other agencies and say, okay, if the city can help with this, they still need X amount. So what other agencies can help with that? And it works very well as a network, the financial assistance network, to get the client what they need to avoid either an eviction situation and remain in their housing, or to keep their utilities on so they don't get disconnected before the winter moratorium kicks in.
Right. Now, what are things, Bob, that our city welfare department can't do? Because I think sometimes people confuse the city welfare department with Department of Health and Human Services.
Yes, that's a very common thing. We get a lot of phone calls of, my food stamps got shut off, how do I get them back on? And so that's an example of one of the programs that the Department of Health and Human Services runs, or the State Welfare Office. So they provide programs such as SNAP, Supplemental Nutritional Assistance Program, otherwise known as food stamps. They provide some cash benefits, TANF, Temporary Aid to Needy Families.
Do they still call it TANF?
They do. There are various programs within that TANF cash assistance program, but the general title is TANF.
Right. And again, it's temporary assistance.
Temporary assistance.
But that's longer than the one or the limited assistance that can be provided for at the welfare department, correct?
That can be up to like 5 years that they can receive this benefit while they have children in the household. And there are different eligibility requirements for that you have to apply through the State Department of Health and Human Services. They also have some old age assistance and aid to needy and blind individuals.
Do they really call it old age?
OAA, that's what they call it. OAA.
Old age assistance.
Right. And
do you know what the old age assistance, like, is that a certain, like, is it 50, 60?
I think it's 62.
62?
So
that's old age,
I got a few years to go myself.
Ooh, I don't have a few years to go for that. I've got less than a couple of years for that.
And some of those programs also supplement, like, mainstream Social Security benefits. In which they also have different benefits for people that are retired. They collect Social Security retirement income, but they also have a disability benefit for people that are disabled and have a certain number of working quarters. They may qualify for what's called SSDI, the Social Security Disability Insurance Program. And they also provide the Medicare insurance for retired individuals through Social Security, while the state has the Medicaid program, which is insurance through the state.
Right. Okay. Now, is there any age limit to, age restriction, I should say limit, for folks getting assistance from the city's local welfare department?
Yes. If you are applying through the city of Nashua, you need to be an adult of 18 years old. There are some basic things we need to check. We need a government-issued ID so we can identify and confirm you are who you say you are.
So that would be either a non-driver's license, driver license, or your passport.
Yeah, something like that.
Okay. What about, can a person just bring, if they don't have an ID, can they just bring something that has their address on it?
We really need an ID because that's the only thing that really verifies they are who they say they are.
Okay.
Unfortunately, some people they try to apply for things that they may not be entitled to,
Okay.
and they may not truthfully represent who they are. So
Right,
we need
right.
that government issued ID so that we can verify they are who they say they are. Also, if they are in need of some sort of assistance, like temporary assistance in, say, a motel because they're experiencing homelessness, the motels or hotels need some identification for
Okay.
the guest as well. So that is a limitation, and the challenge there is that a lot of folks, or some folks that are experiencing homelessness, for example, they don't have a consistent place to store their belongings. They may lose things.
Right,
So
right.
that can become a challenge. And we try to work within that. If we can't assist someone for whatever reason, what we try to do and focus on is connecting them to some other resource within the community. As I mentioned, if someone's experiencing homelessness, for example, when they come to see us, we're going to try to connect them to a shelter program because we want them to get a roof over their head, but also to have access to essentials that they need, such as food and maybe some case management supports and some
Right.
guidance there. One of the other things that we've been able to do, not just for folks experiencing homelessness, but primarily is work closely with our community health workers within the division. That came on, this was primarily a COVID initiative where we were able to bring a lot of these folks on, but they have been doing a lot of outreach to the homeless communities and connecting them to resources such as City Welfare.
Right.
And they can also do some of that follow-up. So if we're helping someone in a motel, for example, we're mainly case technicians. That used to be our formal title. We've kind of evolved into more of a welfare specialist role because we're doing a lot of referrals and things like that.
Right.
But we're not true case managers in the sense of going out and doing a lot of case management in the community
Right.
and connecting people to resources in that way, which a lot of the community health workers have been able to do. So we can talk to a client we're assisting in a motel and say, are you interested in working with a community health worker? And then we can have that community health worker assigned to go out and assist them in the community and guide them through some of the requirements that we have.
Right.
Because one of the other pieces of the eligibility, if you need some ongoing assistance, there are certain things that we're going to require you to do, such as
Right,
apply
right.
for maybe transitional housing if it's appropriate for your household, or apply for state benefits if you're not already receiving them, or apply for Social Security disability if you don't already get that and you are disabled and cannot work. And so the community health workers have been able to help some of those folks navigate
Right,
those systems.
right. Yeah.
They've also been very helpful in trying to help people find housing. In this housing market, it's been very difficult. One of the things that we've experienced, and this isn't just a Nashua unique phenomenon, this
No,
is a
this
statewide
is
thing,
this is national.
is that people are getting into these shelter programs, but they're struggling to move on into more permanent housing just because of the lack of affordable
Right, right.
permanent housing.
Yeah, and like
So-
I said, that's a national thing. So we know
Yes.
that we're experiencing it in New Hampshire. We're experiencing it in our Hillsborough County region. We're experiencing it locally in Nashua, but it's a national phenomenon. This thing
Yes.
with the housing crisis and what we're seeing with more individuals experiencing homelessness, and we've seen an increase as well as you know, Bob, with the elderly populations and some of the complexities
Yes.
that are that we're observing within that population as well.
Right,
So,
right.
Bob, you mentioned a couple of things. You mentioned the fact that our welfare department and our services are looking at social determinants of health, and we've also realized that there's quite a bit of complexity that is going with those social determinants. So let's talk a little bit more about that, because that's a term that we in social services, we in public health, and now even in the medical sector, we're using this term social determinants of health, which looks at those social factors that are the drivers for health outcomes for folks. And so if there are reinforcing things in place that make things more positive for folks, they have good health outcomes.
Sure.
If there are gaps, in those areas, then there are some social factors that then create barriers for people being able to achieve optimum health or being able to maintain the best health that they can.
Sure.
So some of those drivers, so let's talk about some of those drivers, because I always talk about our welfare department as being like the sentinel. Like if there's certain things happening
Yeah.
and we see people that are coming to welfare for assistance for food or for housing in particular, but if they also need support for transportation or for burial services or other factors, that starts to mean something, right? So can you talk a little bit about some of the things that you have been noticing? You've been doing this for 23 years, Bob.
Yeah.
Some of the changes, some of the trending with regards to those social factors that have presented as challenges for people in our community.
Well, again, just the basic cost of housing has impacted everyone. But when you think about, you mentioned like the senior population or elderly population, a lot of those folks are on fixed incomes.
Correct.
They don't have any employment earnings. When Social Security goes up, it goes up a little bit. It doesn't always go up a significant amount.
Right.
And in some instances, if there's a couple living together collecting 2 Social Security benefits and one of them passes away, that's almost half, 40% or so of their income
gone.
is now gone because they don't continue to collect both of those benefits. They'll get the larger of the 2. But their costs don't always go down unless they're in some sort of subsidized housing program that, their rent is adjusted based on their income. But if they're in just a mainstream apartment or they have a home and they still have to keep up with their taxes, even if the mortgage is paid, those expenses don't always go down.
Right, and then you've
And
got
the
the
cost
other
of
things,
food
right?
and the cost of utilities,
medications, right?
et
That's a big
cetera.
cost for our
So-
aging population, right? Yeah.
So that's a big thing, and that's something that we've seen more of. And one of the other organizations that we work closely with are the hospitals, because they have maybe elderly patients or people that are medically compromised, and they're ready to be released from the hospital. But some of those folks are homeless, and they don't have a place to be discharged to. So we try to work with them to make sure they at least have a place to go to, even if it's temporary, so that they can heal until they can get into another mainstream program. So it's a very systemic process that takes place. There are lots of pieces and agencies involved along the way to help a lot of folks in the community.
Right.
One of the other pieces I wanted to mention when you talked about different populations is the youth population, which we've also seen an increase over the past few years of youth that are experiencing homelessness for whatever reason. And so the community, as part of a community, we are, the city is part of the Greater Nashua Continuum of Care. And through that collaboration of nonprofits and different representatives in our community, we were able to apply for what's called the Youth Homeless Demonstration Project, which we were awarded. We've applied for a number of years, but we were finally awarded that over the past year.
Okay.
And so that's starting to be implemented in our community with about $1.2 million over a 2-year period to help youth under 25 that are experiencing homelessness to get housed and have other support services there. So that's just another example of, it's not a city welfare program, but it's a community program that we work in conjunction with to help direct people to get the services they need and support.
So it's something that looks at, if we look at our entire public health system and all of those collaborating partners that participate in addressing those needs, the continuum of care falls, and we say the Greater Nashua Continuum of Care because it includes Nashua and the surrounding towns with regards to looking at those, mostly housing or the lack thereof. So the Greater Nashua Continuum of Care is mostly focused on addressing the housing issue or making sure we have housing stability. Is that correct?
I would say that's a primary role, but they also look at other factors, as you had mentioned. When we look at the social determinants of health, we look at, but it's almost each case on a case-by-case basis. What are those needs for that particular household?
Right.
If they need access to health care, like you mentioned that, we try to connect them to one of the federally qualified health centers in our community, whether it's through Harbor Care or Lamprey, so that people aren't getting their primary care through the emergency departments in the hospitals. It's not the best way to get your primary care. So again, based on what the household needs. If it's a single mother with children, we can refer them to one of the transitional housing programs to apply and hopefully get into that program to stabilize, get supports, to eventually get into permanent housing.
Right.
So there are a lot of interim steps along the way, and it's important for us, and what we try to be aware of as staff for the welfare department is what these programs are,
Right.
who they can serve, and that's why when people come in to see us, we ask a lot of questions.
Right.
We try to get a lot of information, not to be nosy, but just to understand what is your need and what are some possible programs that could provide solutions to meet these needs.
Right, right.
So,
Yeah, and it's a very, well-run efficiency, I should say efficient way of collecting the data that's needed or the information that's needed to be as helpful as we can to the community when they do come in for those services. And we know that, folks may not, it's not going to be the first place that people want to run into, to admit, I need emergency assistance, right? But people do and can find themselves in a situation or circumstance where that's needed. And so, every municipality in the state of New Hampshire has the ability to provide some assistance and then work across the towns with assisting individuals, right?
Yes, correct.
Exactly.
One of the other organizations that I'm a member of is the New Hampshire Local Welfare Administrators Association. And one of the things that we try to promote is best practices and provide education to municipalities across the state, because every municipality is different. We're a large city. We have a lot of shelter programs and mental health programs and access to health care right within our community. We have public transportation. Some of the smaller communities don't have that.
Right.
So,
and again, those are those social factors, right?
Correct.
Lack of transportation is going to reduce your access, right, to services if you can't get there. If you can't get there from here, that's a social determinant that can impact the person's economic stability and their health stability. So with that, all of the municipal welfare officers work together collaboratively to address an individual's needs or family needs.
We do promote that.
Yes.
We try that, and sometimes it's easier than other times. But we get more and more calls from our neighboring communities to say, they'll call up and say, hey, I have this case. What can I do with this? And it makes sense for us to try to help them navigate that case so that that community can assist that person in their community rather than uplifting or uprooting them and moving them to a different community where they may not have the same social support system. So
and
that's another piece of it.
Whole piece around the social supports is so important. So Bob, in the last time that we have, what is the most important thing that you want our viewers to know about our local welfare department?
I would say if you know people that have some issue, they're struggling with something, a financial hardship, they can always reach out to us, give us a call, and we're happy to explain the process and how we may be able to help them.
Bob, thank you so much for being here today. So we're very happy to have had Bob Mack, who is our welfare officer, here to talk about those things in public health that matter, and housing stability and addressing social determinants of health through our welfare department are things that matter in public health. I'm Bobbie Bagley, and I'm reminding you today to have a great day today and a better day tomorrow. And I'll see you next time on Public Health Matters.